In 2014, Theranos was valued at $9 billion. Its founder, Elizabeth Holmes, was the youngest self-made female billionaire in history. The company promised to revolutionize medicine. Hundreds of blood tests from a single drop, results in minutes, available at your local pharmacy. There was just one problem. The technology never worked. Not partially, not sometimes. The core product, the device Theranos built its entire valuation on, produced results so unreliable they were medically dangerous. And the people responsible for catching this, the board, the investors, the partners, the regulators, either didn't ask the right questions or chose not to hear the answers. This is not just a story about a founder who lied. It's a story about a system that wanted to believe her. Elizabeth Holmes dropped out of Stanford at 19. She founded Theranos in 2003 with a vision that was genuinely compelling: democratize blood testing by making it faster, cheaper, and less invasive. No more vials, no more labs. A single finger prick could replace everything. Holmes was deliberate about her image: the black turtleneck, the deep voice, the Steve Jobs comparison she cultivated rather than corrected. She didn't just pitch a product, she pitched a narrative. A young woman disrupting a broken healthcare system, opposed by an entrenched medical establishment that didn't want to change. Silicon Valley funded the narrative, not the science. The device at the center of everything was called the Edison. Theranos claimed it could run over 200 blood tests from a few drops of blood drawn by finger prick. In reality, the Edison could perform only a handful of tests, and even those produced results that were wildly inconsistent. To hide this, Theranos ran the vast majority of its tests on modified commercial analyzers made by Siemens. But even that was a problem. The samples collected by finger prick were too small, so they were diluted before testing. Diluted samples on machines not designed for them produced unreliable results that were sent to real patients making real medical decisions. Some patients were told they had conditions they didn't have. Others were told they were healthy when they weren't. The technology wasn't just underperforming, it was putting people at risk. None of this was disclosed to partners, patients, or investors. The gap between what Theranos claimed and what it could actually deliver wasn't a matter of overpromising, it was fabrication. The people governing Theranos had almost no ability to evaluate what the company was actually doing. The board included Henry Kissinger, George Shultz, Jim Mattis, Sam Nunn, and William Perry, former secretaries of state and defense, retired senators and generals. What they had in common was prestige. What none of them had was expertise in diagnostics, biotechnology, or medical devices. Holmes selected her board not for oversight, but for credibility. Their presence told investors and partners that Theranos was serious and trustworthy. It worked. Walgreens signed a partnership to install Theranos testing centers inside its pharmacies. Safeway committed over $350 million to build in-store clinics. Neither company conducted adequate technical due diligence. Walgreens had internal scientists who raised concerns about the technology. They were overruled by executives who feared losing the deal to a competitor. The board that was supposed to govern the company instead became a marketing asset, and the companies that should have verified the technology chose speed over scrutiny. Then the people inside Theranos started to talk. Tyler Shultz, grandson of board member George Shultz, joined Theranos in 2013 as a research engineer. Within months, he saw that the Edison wasn't performing as claimed. He raised concerns internally and was told the issues were being addressed. They weren't. Shultz contacted the New York State Department of Health. Theranos discovered the leak and sent lawyers to his home. George Shultz, who had been one of Holmes's most prominent supporters, sided with the company against his own grandson. Tyler Shultz would eventually spend over $400,000 in legal fees defending himself. He wasn't the only one. Erica Chung, another former lab employee, documented quality control failures and reported them to federal regulators. Both whistleblowers would later testify at Holmes's trial. In October 2015, John Carreyrou of the Wall Street Journal published the first in a series of investigative reports that methodically dismantled Theranos' claims. Carreyrou documented that the Edison was used for only a fraction of the company's tests, that results were unreliable, and that patients had received inaccurate diagnoses. Holmes went on the offensive. She appeared on television, called the reporting inaccurate, and framed the investigation as an attack on innovation. For a few months, it almost worked. Then the regulators arrived. The Centers for Medicare and Medicaid Services inspected Theranos' Newark, California lab and found conditions that posed immediate jeopardy to patient health and safety. The lab was shut down. Theranos voided 2 years of test results. Tens of thousands of patients told their results could not be trusted. The FDA classified the Edison as an uncleared medical device. The SEC opened a fraud investigation. Partner after partner withdrew. By 2016, the $9 billion valuation had effectively collapsed to zero. The company that was going to revolutionize healthcare couldn't produce a single reliable blood test. In June 2018, Elizabeth Holmes and Sunny Balwani, Theranos' president and Holmes' former partner, were indicted on multiple counts of wire fraud and conspiracy. The government alleged they had deliberately deceived investors, doctors, and patients about the capabilities of the technology. Holmes' trial began in September 2021. In January 2022, she was found guilty on 4 counts of investor fraud. She was sentenced to over 11 years in federal prison. Balwani was convicted on all 12 counts he faced and sentenced to nearly 13 years. Theranos is not a story about a technology that failed. Technologies fail all the time. It's a story about what happens when the mythology of disruption replaces the discipline of verification. Elizabeth Holmes understood something fundamental about Silicon Valley, that conviction is valued more than evidence. That narrative can substitute for data if you control who gets to ask questions. She built a company designed to resist scrutiny, surrounded herself with people who couldn't provide it, and chose partners who didn't want to demand it. The board was the most credentialed in Silicon Valley history. Not one member asked to see the clinical data. Walgreens deployed the technology without independent validation. Investors valued Theranos based on the founder's charisma rather than the product's performance. This is what happens when an industry optimized for speed confuses confidence with competence. The fraud wasn't invisible. It was protected by prestige, by narrative, and by everyone who had a reason not to look too closely. $9 billion, built on a single drop of blood that couldn't deliver a single reliable result.